Welcome to our channel. Today, we're diving into an alarming topic: the U.S. states with the highest cancer rates. Did you know that the U.S. has a population of over 334 million people, and approximately 1.9 million of them are diagnosed with cancer each year? That means around 0.57% of the U.S. population battles this devastating disease annually. Even more concerning is that cancer rates have increased by about 3% over the past decade. Each year, around 609,000 Americans lose their lives to cancer, an average of over 1,600 deaths per day. But why are certain states more affected than others? What types of cancer are most common in these states? How have the cancer rates and death tolls changed over the years? Stay tuned as we unravel these mysteries. Don't forget to hit the like button, subscribe, and watch till the end. This information could be life-changing. Number 10. Indiana. Rounding out the list is Indiana, with a cancer rate of 446 per 100,000 people in 2024, a 5.7% increase from 422 in 2021. The death rate in Indiana is 170 per 100,000 people, with lung, breast, and colorectal cancers being the most common. Did you know that industrial pollution is a significant factor contributing to Indiana's high cancer rates? Many areas in Indiana are exposed to high levels of toxins from manufacturing plants, which increase the risk of cancer. Additionally, Indiana has high rates of smoking and obesity, which are major risk factors for cancer. The state also struggles with healthcare access, particularly in rural areas, leading to late-stage cancer diagnoses and higher mortality rates. Number 9. Missouri. Missouri's cancer rate in 2024 is 450 per 100,000 people, up from 427 in 2020, a 5.5% increase. The state also has a death rate of 172 per 100,000 people, with lung, breast, and colorectal cancers being the most prevalent. Why Missouri? Did you know that radon exposure is a significant but often overlooked risk factor for cancer in Missouri? Radon, a naturally occurring radioactive gas, can seep into homes and is a leading cause of lung cancer. In addition to radon exposure, Missouri has high smoking rates and obesity levels, which further contribute to the state's high cancer rates. Despite these risks, public awareness and preventive measures are lacking, leading to a steady increase in cancer cases and deaths. Number 8. Tennessee. Tennessee reports a cancer rate of 456 per 100,000 people in 2024, a 5.1% increase from 434 in 2019. The death rate is also high, with 175 deaths per 100,000 people, driven largely by lung, breast, and prostate cancers. Did you know that health disparities play a significant role in Tennessee's cancer crisis? African Americans in Tennessee are disproportionately affected by cancer, with higher incidence and mortality rates compared to their white counterparts. This disparity is due to a combination of factors, including lower socioeconomic status, limited access to health care, and higher rates of risk factors like smoking and obesity. Additionally, the state's healthcare system is under strain, making it difficult for many to get the necessary care, leading to late-stage diagnoses and higher mortality rates. Number 7. Oklahoma. Oklahoma's cancer rate is 460 per 100,000 people in 2024, up from 435 in 2018, a 5.44% increase. The state's cancer death rate is 174 per 100,000 people, with lung, breast, and colorectal cancers being the most common. Why is Oklahoma seeing such a rise in cancer rates? Did you know that Oklahoma has one of the lowest rates of cancer screenings in the country? This lack of early detection is a significant factor contributing to the state's high cancer rates. Additionally, high tobacco use, obesity, and limited access to health care, especially in rural areas, are exacerbating the problem. The result? More advanced cancers that are harder to treat and more likely to be fatal. Number 6. Alabama. Alabama's cancer rate is 463 per 100,000 people in 2024, up from 439 in 2017, a 5.33% increase. The state's death rate from cancer stands at 178 per 100,000 people, with lung, breast, and prostate cancers being the most prevalent. Did you know that both genetics and lifestyle choices are contributing to Alabama's high cancer rates? Many residents carry genetic predispositions for certain cancers, which, when combined with high smoking rates and poor diets, significantly increase their cancer risk. Additionally, Alabama has one of the highest rates of human papillomavirus infections, which is directly linked to cervical cancer. However, despite the risks, vaccination rates remain low, further driving up cancer rates in the state. Number 5. Louisiana. Louisiana's cancer rate is 470 per 100,000 people in 2024, up from 444 in 2014, a 5.7% increase. The death rate here is particularly high at 180 per 100,000 people, with lung, breast, and colorectal cancers being the most common. Why Louisiana? Did you know that Louisiana is home to an area ominously known as Cancer Alley? This 85-mile stretch along the Mississippi River is densely packed with petrochemical plants, and the residents are exposed to high levels of toxic pollution, which significantly increases cancer risk. The combination of environmental hazards, high smoking rates, and poor access to healthcare creates a deadly mix that drives up cancer rates and mortality in the state. Number 4. Arkansas. Arkansas has a cancer rate of 471 per 100,000 people as of 2024, reflecting a 4.8% increase from 2016 when the rate was 450 per 100,000. The death rate is also troubling, with 175 deaths per 100,000 people, predominantly from lung and colorectal cancers. Did you know that lifestyle choices are a major factor in Arkansas's high cancer rates? Smoking and obesity are rampant in the state, with over 22% of adults being regular smokers and nearly 35% classified as obese. These factors are closely linked to the state's high rates of lung and colorectal cancers. Additionally, rural areas in Arkansas have limited access to healthcare, leading to late-stage diagnoses, which are harder to treat and more likely to result in death. Number 3. Mississippi. Mississippi's cancer rate is 482 per 100,000 people in 2024, up from 457 in 2015, a 5.41% increase. The state's death rate from cancer is one of the highest in the country, with 183 deaths per 100,000 people. Lung and breast cancers are the most prevalent types found here. The state faces significant challenges due to its high poverty rate and large uninsured population, which limit access to early detection and treatment. Did you know that obesity is a significant factor in Mississippi's cancer rates? With nearly 40% of adults classified as obese, the state sees a higher incidence of cancers linked to obesity, such as breast and colorectal cancers. Moreover, the high smoking rate further fuels the fire, leading to an increase in lung cancer cases. Number 2. West Virginia. West Virginia isn't far behind, with a cancer rate of 494 per 100,000 people in 2024. This marks a 6.2% increase since 2012, when the rate was 466 per 100,000. The death toll is particularly grim, with 178 deaths per 100,000 people, driven largely by lung and colorectal cancers. Did you know that poverty plays a significant role in West Virginia's cancer crisis? This state is one of the poorest in the nation, and with poverty comes limited access to healthcare, poor nutrition, and high smoking rates, all of which contribute to the state's high cancer rates. The prevalence of smoking, combined with low cancer screening rates, leads to late diagnoses and higher mortality. Number 1. Kentucky. Did you know that Kentucky holds the unfortunate title of having the highest cancer rate in the United States? As of 2024, Kentucky reports a staggering 513 cancer cases per 100,000 people. This figure represents a sharp increase from previous years, with a rise of about 4.95% since 2010, when the rate was 489 per 100,000. The death rate is equally alarming, with 185 deaths per 100,000 people, primarily due to lung cancer. The reasons are as deep-rooted as they are devastating. The state's leading cause of cancer is smoking. 23% of Kentucky adults are regular smokers. Lung cancer in particular is rampant here, with the state having the highest rate in the nation. But that's not all high obesity rates. Poor diet and limited access to healthcare, especially in rural areas, exacerbate the situation. These factors combine to create a deadly environment where cancer rates have skyrocketed. If you found this information eye-opening, don't forget to like, subscribe, and comment below. Your support helps us bring more crucial information to light. Thanks for watching, and take care of your health.